In Germany, cardiologists legally prescribe a flower to patients with heart disease, not as a supplement, but as an actual medicine. This flower strengthens your heart muscle, lowers blood pressure, improves circulation, and prevents heart attacks. Clinical trials prove it works as well as pharmaceutical drugs. Sometimes better in America. Almost nobody knows about it because there's no profit in a flower that grows wild everywhere. This is a hawthorn, the heart herb that European doctors have trusted for over 1,000 years. If you or someone you love has heart disease, high blood pressure, or it takes cardiac medication, this might save your life. Heart disease is the #1 killer worldwide. Over 18 million deaths per year. In America alone, someone has a heart attack every 40 seconds. One person dies from cardiovascular disease every 36 seconds. The numbers are staggering. Over 120 million Americans have some form of heart disease: high blood pressure, coronary artery disease, heart failure, arrhythmias. Doctors prescribe medications: statins for cholesterol, beta blockers for blood pressure, ACE inhibitors, diuretics, blood thinners. These drugs save lives. I am not denying that. Modern cardiology has achieved incredible things, but these medications come with problems. Side effects can be brutal: muscle pain, fatigue, digestive issues, kidney damage, liver problems. Sexual dysfunction. Many patients stop taking their medications because they feel worse on them than off them. And here is the real issue. Most cardiac drugs treat symptoms. They lower blood pressure, they thin blood, they reduce workload on the heart. But they do not strengthen the heart muscle itself. Your heart is a muscle. Like any muscle, it can become weak. When it weakens, blood does not pump efficiently. Fluid backs up. You get shortness of breath, fatigue, swelling in legs and ankles. This is heart failure. Over 6 million Americans have heart failure. The 5-year survival rate is about 50%. Worse than many cancers. What if there was something that actually strengthened your heart muscle? That improved how efficiently it pumps. That protected your cardiovascular system from damage. That is exactly what hawthorn does. Hawthorn is a small tree or shrub. It grows throughout Europe, Asia, and North America. You have probably seen it. It has thorny branches, white or pink flowers in spring, and small red berries in autumn. For over 2,000 years, healers have used hawthorn for heart problems. Ancient Greek physicians prescribed it. Traditional Chinese medicine includes it. European folk medicine centers around it. In medieval Europe, hawthorn was called the heart tree. Herbalists used the berries, flowers, and leaves to treat what they called weak heart, irregular pulse, and dropsy, which we now call heart failure. They did not understand the science. They did not know about blood pressure or cholesterol or cardiac output. But they observed that people who took hawthorn felt better, breathed easier, had more energy, lived longer. In the late 1800s, medical doctors began studying hawthorn scientifically. Irish physician Dr. Green published papers on its effectiveness for heart disease. German doctors started prescribing it regularly by the mid-1900s. Hawthorn extracts were being manufactured and tested in clinical settings. Researchers identified the active compounds, flavonoids, proanthocyanidins, oligomeric, K-procyanidins. These compounds have specific cardiovascular benefits. They dilate blood vessels. They improve blood flow to the heart. They increase the force of heart contractions. They protect heart cells from damage. In Germany today, hawthorn is an approved medicine for heart failure. Doctors prescribe standardized hawthorn extract as first-line treatment for mild to moderate heart failure. Health insurance covers it. Over 200 clinical studies have been conducted on hawthorn. The results are consistent. It works, yet in America, it remains obscure, dismissed as just another herbal supplement. Why? Because you cannot patent a plant. Pharmaceutical companies cannot make billions from something that grows wild. So there is no marketing, no medical school education, no research funding compared to patented drugs, but the science exists. The history exists. And millions of Europeans use it successfully. Let me explain what hawthorn actually does in your body. Mechanism. 1. Increases cardiac output. Cardiac output is the amount of blood your heart pumps per minute. When your heart muscle is weak, output drops. Less blood means less oxygen to your tissues. Hawthorn contains compounds that increase the force of heart muscle contractions. This is called positive inotropic effect. Your heart squeezes harder with each beat. More blood gets pumped with the same effort. A study, published in the American Journal of Medicine, found that hawthorn extract increased cardiac output by up to 10% in heart failure patients. Mechanism. 2. Dilates blood vessels. Hawthorn. It relaxes the smooth muscle in your blood vessel walls. This is called vasodilation. When blood vessels dilate, resistance drops. Blood flows more easily. Blood pressure decreases. Research shows hawthorn increases production of nitric oxide. Nitric oxide is the molecule that signals blood vessels to relax. This is the same mechanism that blood pressure medications target. Mechanism? 3. Improves blood flow to the heart. Your heart muscle needs its own blood supply through coronary arteries. When these arteries narrow or become blocked, you get angina or heart attacks. Hawthorn specifically improves coronary artery blood flow. It dilates these arteries. More oxygen reaches your heart muscle. This reduces chest pain and protects against heart attacks. Mechanism. FOUR. Antioxidant protection. Oxidative stress damages heart cells. Free radicals attack cell membranes, DNA, and proteins. This accelerates aging and disease. Hawthorn is rich in antioxidants, particularly flavonoids. These compounds neutralize free radicals. They protect heart cells from oxidative damage. A study in the journal. Phytotherapy research found that hawthorn extract significantly reduced oxidative stress markers in cardiac patients. Mechanism. 5. Regulates heart rhythm. Irregular heartbeat or arrhythmia can be dangerous. Hawthorn has been shown to help stabilize heart rhythm. It affects calcium channels in heart cells, which control the electrical signals that coordinate heartbeats. Mechanism. SIX. Lowers cholesterol. Some studies suggest hawthorn helps reduce LDL cholesterol and triglycerides while increasing HDL cholesterol. The effects are modest but beneficial. The key point is that hawthorn works through multiple pathways. It is not just lowering one number. It is supporting overall cardiovascular health now. Let me show you what the research actually says. Study 1. The spice. Trial death. This was a large study published in the European Journal of Heart Failure in 2008. It included 2,681 patients with chronic heart failure. Patients taking hawthorn extract along with their standard medications had significantly improved symptoms. Better exercise tolerance, less fatigue, less shortness of breath. The Hawthorn group all said fewer hospitalizations for heart problems. Study 2. Cochrane Review. The Cochrane collaboration is the gold standard for medical evidence review. In 2008, they analyzed 14 clinical trials on hawthorn for chronic heart failure. Their conclusion was that hawthorn extract significantly improved symptoms and exercise tolerance. It increased maximum workload during exercise tests. Patients could do more before getting tired. Study 3. Comparison to pharmaceutical drugs. A German study compared hawthorn extract to the drug captopril, an ACE inhibitor commonly prescribed for heart failure. The results showed that hawthorn is equally effective at improving symptoms. But hawthorn had far fewer side effects. Patients tolerated it better. Study for blood pressure reduction. A randomized controlled trial published in Phytomedicine gave hawthorn extract to patients with mild hypertension. After 16 weeks, the hawthorn group had significant reductions in both systolic and diastolic blood pressure. The effect was dose-dependent. Higher doses produced better results. Study 5. Angina relief. A Chinese study examined hawthorn for angina, the chest pain caused by reduced blood flow to the heart. Patients taking hawthorn reported less frequent and less severe chest pain episodes. They needed less nitroglycerin medication for symptom relief. The consistent finding across studies is that hawthorn works. It improves symptoms, it increases exercise capacity, it reduces cardiac events, and it is generally very safe. Side effects are rare and mild. Occasionally, some people report mild digestive upset or dizziness. Compare that to the side effect profiles of standard cardiac drugs. If you are interested in using Hawthorn, here's what you need to know. Form 1. Hawthorn Berry Extract. This is the most studied and standardized form. Look for products standardized to contain 1.8 to 2.2% flavonoids or oligomeric procyanidins. The typical dose used in clinical trials is 300 to 900 milligrams per day, divided into 2 or 3 doses for heart failure. Studies often use 900 milligrams daily. For blood pressure support, 300 to 600 milligrams may be sufficient. Form 2. Hawthorn Tincture. This is an alcohol extract of hawthorn berries, flowers, or leaves. It is more traditional and less standardized than capsules. Typical dose is 1 to 2 milliliters, 2 to 3 times daily. Form 3. Hawthorn Tea. You can make tea from dried hawthorn berries or flowers. This is the gentlest form. Steep 1 to 2 teaspoons of dried hawthorn in hot water for 10 to 15 minutes. Drink 2 to 3 cups daily. Tea is less concentrated than extracts, so effects are milder. But it is a good starting point or maintenance option. Form for fresh or dried hawthorn berries. If you have access to hawthorn trees, you can harvest the berries in autumn. Eat them fresh or dry them for later use. They are tart and slightly sweet. You can eat them plain, make jam, or cook them into sauces. Timing and consistency. Hawthorn is not a quick fix. It takes time to build up in your system and produce effects. Most studies show benefits appearing after 6 to 8 weeks of consistent use. This is a long-term therapy. Think of it like strengthening a muscle through exercise. You need consistency over months. Safety and interactions. Hawthorn is very safe for most people. It has been used for thousands of years with minimal problems. However, if you are taking heart medications, you must talk to your doctor before adding Hawthorn. This is critical. Hawthorn can enhance the effects of cardiac drugs. If you are on beta blockers, ACE inhibitors, or digoxin, Hawthorn may increase their effects. Your medication doses might need adjustment. This is not a reason to avoid Hawthorn. It just means you need medical supervision. Many European doctors actively combine Hawthorn with standard medications for better results. Do not stop your prescribed medications and switch to Hawthorn without medical guidance. That can be dangerous. Pregnant or breastfeeding women should avoid Hawthorn due to lack of safety. Data in these populations. If you have low blood pressure, start with a low dose of Hawthorn and monitor how you feel. It can lower blood pressure further. Where to buy? Look for reputable supplement brands that provide standardized extracts. Brands like Gaia Herbs, Nature's Way, and Herb Farm are widely available and quality controlled. Check for third-party testing. Look for certifications from organizations like USP or NSF. Expect to pay $15 to $25 for a 1-month supply of quality hawthorn extract. You can also buy dried hawthorn berries from herbal suppliers like Mountain, Rose, Herbs, or Star West Botanicals. Let me step back and talk about what Hawthorn represents. We have a healthcare system that prioritizes patented drugs over natural remedies. Not because natural remedies do not work, but because they cannot be monopolized. Hawthorn has over 200 clinical studies supporting its use. It is prescribed by doctors in Germany and other European countries. It is covered by health insurance there. Yet American cardiologists rarely mention it. Why? Because they are not taught about it in medical school. Because pharmaceutical companies do not market it. Because there is no profit incentive. This creates a gap in care. Patients suffer from medication side effects. They struggle with drug costs. They experience reduced quality of life. Meanwhile, a safe, effective, affordable option exists, growing wild in parks and forests, available for pennies compared to prescription drugs. I am not saying Hawthorn should replace all cardiac medications. Severe heart disease requires serious medical intervention, but for mild to moderate heart failure, for high blood pressure, for general cardiovascular support, Hawthorn deserves consideration. European medical systems have integrated it successfully. Germany has decades of clinical experience with Hawthorn as prescription medicine. Their cardiovascular outcomes are excellent. The science is solid. The safety profile is excellent. The historical use spans millennia. What is missing is awareness, education, and a medical system willing to look beyond the pharmaceutical model. That is why channels like this matter. Information that the healthcare industry will not provide needs to reach people directly. Hawthorn is powerful, but it works best as part of a complete approach to heart health, diet, reduce processed foods, sugar, and trans fats. Eat more vegetables, fruits, whole grains, and healthy fats like olive oil and omega-3 south. Exercise. Even moderate activity like walking 30 minutes daily significantly reduces heart disease risk. Movement strengthens your heart muscle naturally. Stress management. Chronic stress damages your cardiovascular system. Practice meditation, deep breathing, or yoga. These lower blood pressure and reduce cardiac workload. Sleep. Poor sleep increases heart disease risk. Aim for 7 to 8 hours per night. Sleep is when your body repairs cardiovascular damage. Other herbs, consider combining hawthorn with other heart-healthy herbs. Garlic lowers blood pressure and cholesterol. Ginger improves circulation. Turmeric reduces inflammation. Regular checkups. Monitor your blood pressure. Get cholesterol tested. See your doctor regularly. Hawthorn is complementary, not a replacement for medical care. Think of heart health as a multi-layered approach. Hawthorn is one powerful tool in your toolkit. So there you have it, Hawthorn, the flower that European doctors prescribe for heart disease. The herb with over 2,000 years of traditional use and over 200 modern clinical studies, it strengthens your heart muscle, it lowers blood pressure, it improves circulation. It protects against heart attacks if you have heart disease. You are on cardiac medications. If you have high blood pressure, talk to your doctor about adding hawthorn. Show them the research. Ask if it is appropriate for you. If this video gave you information your doctor never mentioned, subscribe to Timeless Nature. We uncover natural remedies that work but are ignored by mainstream medicine. Drop a comment. Have you used hawthorn? Did it help your heart health? Are you going to try it? Share your experience. Share this video with anyone who has heart disease or takes cardiac medications. This information could save a life. Until next time, remember, nature has provided solutions for thousands of years. We just need the courage to use them. This is Watering Nature, where ancient wisdom meets modern science.